Okay, let's try to guess another case. A 46-year-old man is brought to the ER after being involved in a serious motor vehicle collision. The trauma team determines that the patient has an isolated head injury and he will need to be intubated. As the anesthesiologist on call, you are asked to help with a rapid sequence, induction of anesthesia and intubation. As you prepare to intubate the patient, you ask the trauma nurse to administer medication that indirectly potentiates GABA receptor activity and is commonly used for anesthesia induction. So what is this? These are barbituates. So similar drugs: phenobarbital, thiopental, pentobarbital. Mechanism of action: they indirectly potentiate GABA A receptor activity in the brain, thereby increasing the flow of chloride ions, again through adjacent chloride channels, which leads to cell membrane hyperpolarization and decreased activity of the CNS neurons. Clinical use is sedative use in order to treat anxiety and insomnia. Thiopental has also been used for the induction of anesthesia. Phenobarbital is used in the management of seizures and in the treatment of neonatal hyperbilirubinemia. Side effects: sedation, nausea, teratogen. Other barbituates include ctytochrome P-450. They induce ctytochrome P-450, which results in decreased levels of several drugs, such as digitalis, phenytoin, and other drugs, which means that you may have to raise the levels of those drugs because the ctytochrome P-450 results in decreased levels of those drugs. So an overdose of barbiturate is characterized by cardiac and respiratory depression and can be treated with mechanical ventilation, hemodialysis, and alkalinization of the urine. Barbiturates should be avoided in pregnancy, patients with liver disease, patients with porphyria, or in patients who use alcohol, benzodiazepines, or other CNS depressants. So main points here: they induce cytochrome P-450. And so can you remember what it is that inhibited cytochrome P-450? I can't, so I'm going to look back. I don't remember which one. I'm going to remember after this. Okay, selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, have been shown to inhibit cytochrome P-450, thereby enhancing the effects of several drugs metabolized by this enzyme. So remember, SSRIs will inhibit cytochrome P-450, but going back, barbiturates will induce cytochrome P-450.